Dead wrong. HIV/AIDS testing and diagnosis. Lies that have been killing for decades. The World Health Organization suggests not retesting if you feel you have received a false positive diagnosis of HIV. They also suggest a person who may not be infected with HIV should continue antiretroviral medications. PrEP therapy is the same concept without a positive HIV diagnosis, which is often prescribed to individuals with confirmed false positive HIV tests. False positives are much more prevalent than the misleading scientific information would suggest from their controlled studies. World Health Organization, HIV/AIDS, Quality of HIV Testing and Prevention of Misdiagnosis, Questions and Answers, from August 29, 2017. What should be done if a person on antiretroviral therapy is suspected to have been misdiagnosed with HIV? WHO recommends that people with HIV who are on antiretroviral therapy should not be retested for HIV due to the risk of false negative results. People diagnosed with HIV who are on antiretroviral therapy but suspected of misdiagnosis should not have their antiretroviral therapy discontinued to retest and confirm misdiagnosis. Self-testing using blood-based and oral fluid tests is not recommended for people on antiretroviral therapy. Occasionally, a person may have been started on antiretroviral therapy on the basis of a single reactive HIV test result. In such cases, there is a small chance that this single result was a false reactive result. These cases should be considered on an individual basis by review of the person's clinical records and medical history, exposure risk and partner's HIV status if this is known, and an assessment on how to proceed made by their clinician. It is important, therefore, that all people testing for HIV are informed that if they are taking antiretroviral therapy, that they should not test again. If they have concerns about the possibility of being misdiagnosed, they should discuss their concerns with their clinician. WHO is working to assess new evidence on providing additional guidance on retesting people using PrEP and possible testing strategies or approaches for testing people on antiretroviral therapy, and further guidance will follow. HIV diagnoses are given based on constantly changing algorithms because there are no tests for the HIV virus. Even now, in 2019, there has never been a test to detect HIV or infection caused by HIV. Below, you will see the CDC's guidance from May of 2018 for clinicians who are testing for HIV. It shows that they should expect that in areas with a lower prevalence of already diagnosed HIV infection, they will find a higher amount of false positive tests, whereas in areas that are more prevalent for already diagnosed HIV infection, they will find less false positives based on the area. A few things known to cause false positive or false reactive rapid tests, ELISA, or Western blot tests. Antibodies to HLA antigens, multiple blood transfusions, influenza vaccine, open air contamination of specimens, freezing and thawing of specimen, naturally occurring antibodies, heating of specimen, pregnancy, HIV testing is opt-out for pregnant women, meaning it is done automatically unless otherwise requested by the patient. Influenza, Epstein-Barr, human herpes virus 4, HHV4, which is also mononucleosis. Mycobacterium avium, systemic lupus erythematosus, renal failure, kidney failure, herpes simplex 1 and 2, upper respiratory infection, receiving or being exposed to viral vaccines or someone who has received a vaccine, hemodialysis, malaria, hepatitis A and B, lymphoma, tests kept outside temperature range. If you look any of this up, you will see the emphasis on false negatives before false positives. Kary Mullis, a Nobel Prize-winning biochemist, said this: "It's not even probable, let alone scientifically proven, that HIV causes AIDS. If there is evidence that HIV causes AIDS, there should be scientific documents which either singly or collectively demonstrate that fact, at least with a high probability. There are no such documents." Kary Mullis invented the PCR, polymerase chain reaction test, that is said to confirm diagnosis of HIV and test for viral load. The problem is, he made it clear that his invention can't be used to measure viral load of any virus because it makes more of it.